Last time I had you on was back in March when you discussed your bipartisan legislation, the Kids Online Safety Act. Now you're working on more bipartisan bills, this time in the healthcare sphere. What can you tell us about the most recent one, which is the Patients Before Middlemen Act?
This is something Senator Menendez and I are working on. And we hear a constant complaint from our Medicare enrollees and really from so many Tennesseans about the price of pharmaceuticals at the pharmacy counter. And as we have looked at this and researched the issue, what we have found out is these pharmacy benefit managers, the middlemen, if you will, are taking the profits, the discounts that are offered on certain pharmaceuticals, they're taking those for themselves. And that the patient is paying a higher copay or, in some cases, a higher price to have access to medicines that are on the allowed list from their insurance company. And when you have the pharmacy benefit manager and the insurance company taking those discounts or offered by the drug company, then the patient is the one who is left out. So our bill, the Patients Before Middlemen or PBM Act, would require that the patient be the one to benefit from these reductions in cost, and that money not go to the middleman, the pharmacy benefit manager.
So, does this cut out the middleman or just redirects the profit?
What this would do is circumvent that profit from going to the pharmacy benefit manager. And one of the things that we have figured out is that there is very little value added for the consumer that comes from these pharmacy benefit managers. Now, in the beginning, when they were put into place, maybe they played a part in negotiating with these drug companies to lower the cost. But what has happened is, as they have absorbed the majority of the discount that is offered and shared some with the insurance company, the patient has found that they were out. And Brittany, another problem with this is that these pharmacy benefit managers may take different pharmaceuticals off the allowed list. When that happens, who is it that is going to be in search of something that has been prescribed for them as the preferred pharmaceutical? It's the patient. And I had talked recently with a mom who was facing this. The physician had prescribed a specific pharmaceutical for her child. And then the insurance company changes, middle of the year, changes what is allowed. They took off what this mom had been using for her child. And then she was in a mad scramble trying to continue the medication that her child needed. This is something that could not be interrupted. And she was spending hours and days on the phone with the insurance company trying to get something that would help her continue the care that was necessary for her child.
Something that's really is a disgrace is the cost of some prescription drugs. I mean, you've heard stories of people spacing out how often they take their drugs so that they can save some money, and that's just not right. So how much or by how much would this lower the cost of prescription drugs?
I think more important than looking at it that way is thinking in terms of access. What people want is access to the drug, the medication that their doctor has said, you need this specific drug or you need this specific therapy, and here is a generic that you also could use in place of one of those. Now, that allows people to have choice and options and to control what they're going to have to spend because they have those options. Now, if that PBM takes those generics off or disallows certain things, then what happens? The patient is going to have less choice, and when there is less choice, they always end up paying a higher price.
And is the generic drug just as good as the other one, the higher priced one that the PBM would be offering?
That's something that is going to be a case-by-case situation, and this is something that patients need the opportunity to discuss with their physician and then thereby make that choice. But what you want is for the patient to be able to control what they are going to choose. Give them choice, give them options, give them the opportunity to control that cost. And when I talk to Tennesseans, that's what they want. They want to be able to work with their physician and decide what is going to be best for them and their family. They don't want a bureaucrat or someone at an insurance company or someone at a PBM saying, we don't care what the doctor tells you. We're not going to let you have that. If you want something, you're going to have this. That's not what they want. Our seniors in Medicare say, we have been paying into Medicare all of our working life, and now we're being told we can't have what the doctor says we need. So the PBM Act is a way to remove this roadblock and allow patients the access and the choice they need.